Hello everyone, my name is Erica and I'll be discussing primary care behavioral health services and the essential component of integrated health. 1/3 of all adults that are receiving medical care also have a behavioral health condition such as depression or anxiety. If there's 300 of us today, that means 100 of us is facing these challenges, and that means 1/3 of the students in our school as well. Additionally, 70% of people who are receiving behavioral health care also have an overlapping medical condition. This can range from persistent headaches to insomnia to chronic conditions such as diabetes and hypertension. Many of you may be aware that there are also behavioral health services throughout clinics, but you may not be sure what this means or how to access these services. I would like to provide an overview of these behavioral health services in primary care and who consists of this team-based approach. I currently work for an organization that these services are provided and work closely together with behavioral health consultants. About 70% of patients who come to see a family medicine doctor come with a behavioral health issue such as depression or anxiety. So it is a core part of behavioral health. Behavioral health consultants will talk about the target issue and come up with goals. They will discuss their diabetes and blood pressure and what stress they're under and why that stress is impacting their health so that it becomes a comprehensive plan, medical and behavioral health. Behavioral health consultants can help with coping with medical problems, stress, anger, or anxiety, changing risky behaviors like tobacco and alcohol use, difficult life problems or family problems, child behavior problems, eating and activity changes for a healthy weight, learning and memory problems, and a variety of other mental health issues. What to expect when you see the behavioral health consultants. Visits can range from 15 to 25 minutes. The behavioral health consultant will meet with you and focus on the issue that is concerning you and your primary care physician. Together, they will work on a plan to improve the issue. Often patients only need to see the consultants once to learn a new skill or a perspective that will lead to positive changes over time. At other times, patients will schedule return appointments to learn more and continue on a positive path. You may be asking, what is a patient-centered medical home? Primary care got together and developed this series of joint principles where the nurses, the front desk staff, the doctors, the psychologists all work closely together to help the patient and really try to put the patient in the center of the equation and do everything that the patient needs, whoever this might be, to help them. The nurse or medical assistant will be working up the patient and will know that the patient has diabetes. The last time they were there, they talked to their provider about how they were going to join the gym or they were going to get started on a new medication or some changes that happened at the previous visit. And then I ask, how's it going? And they respond, well, it's been hard for me to lose weight because I don't know what foods I'm supposed to be eating, or I'm just so stressed out with work and that's why my blood pressure is always high. And then we start the process. While they're getting rooms, several of these things we know that need to happen to improve care, that is, the patient would benefit from a visit with one of the behavioral health consultants to discuss dietary and healthy lifestyle changes. That's better care for the patient and more patients are getting more of their needs met. It's a way to give you better and more personal care. Even though it's called medical home, it's not a place. It's actually a much bigger than that. It's a whole team of people who know you and work together to give you the best care. And it's led by your personal care provider who gets to know you and works together with the nurses and the psychologists to make sure everyone is on the same page when it comes to your care. Basically, the team is based up of whoever you need, so it changes your health need changes. They will help you set goals that make sense for you. Then it's up to you to make those changes. Behavioral health consultants and medical staff is changing the way we're caring for people's mental and emotional well-being as well as our physical health. We're recognizing that mental health conditions and addictions are genuine health conditions, just like heart disease or diabetes. We're moving to a system that is more integrated and treats the whole person and leading to integrated care experiences. Unless one's basic needs are met, good overall health is very difficult to achieve. Integrated health will not cost more money. It not only dramatically improves care, but it does so at a lower cost. When people get all the care that they need when they need it in the communities in which they live, they're able to avoid these higher costs, staying out of emergency rooms, and having an overall better quality of life. We need to understand that being both physically and emotionally fit is key to success in all aspects of life. And you can always seek help from experts in this area, because behavior plays a vital role in mental and physical health. Behavioral health is becoming the cornerstone of the biosocial practice. The way behavior may positively or negatively affect the body by stating that lifestyles, life events, and bad behavior are directly related to health and illness. The way we think about events determines our response to them in developing healthy or unhealthy behaviors and changes in behavior. Attitudes to health determine whether we hear or listen to advice from health professionals, and a person's personality may influence the body to certain dysfunctions. Behavior health is used as a generic term to include services for health behavior changes like weight loss, substance misuse, behavior medicine interventions such as chronic pain management, and general mental health services for patient problems, presentations such as depression and anxiety. Most of the things that make people sick today is not communicable disease, it's behavior, and we need more physicians and behavioral health consultants that are prepared to help patients change behavior. There is a lot of good that can be done by this. By bringing different professionals working together, by working closely in a partnership with patients and their families, by getting out of the office and going to the home setting, and then by better coordinating care across healthcare settings. What makes this an ideal place for me to work is that we have many providers from many different disciplines. Usually there's a physician intensely involved, a nurse, there's a social worker, pharmacy, and psychology very well involved. It's a pretty big team dedicated to provide families and patients services that they need. Collaborating is the way that it works. It's a pretty big team, and we have had healthcare teams that will meet and actually discuss certain patients in the offices, so that they'll have the psychologist, one of the physicians, the care coordinator, someone from the nursing staff, and they will all meet and sit and discuss the more complex patients to try to meet those needs and make an incredibly significant difference in outcomes for a specific patient. And I have seen this happen quite a bit. It really is a great team-based care reaching our communities, and we get to access patients that would never otherwise see a mental health provider, and also patients that we know are coming in trying to improve their diet or their exercise or better their lifestyle, or trying to quit smoking or improving sleep. That behavioral health mentors get to impact these patients as well, and not just the traditional mental health way. It's important to have a behavioral health provider within the primary care setting, because behavioral health is no different than any other medical component, no different than a person coming in for high blood pressure. A person may be seen for depression or anxiety, and it's important to treat those different aspects of a person's health the same. Caring for the emotional side is just as important as the physical side. As you as a whole and feel well taken care of, a behavioral health can help you your overall health get better, then everyone deserves it.